Now, there are 5 anxiety disorders: panic, phobia, OCD, PTSD, and GAD. Let's begin with the first one, which is a panic disorder. For you to have panic disorder, you need to have panic attacks. A panic attack is a massive amount of anxiety, lasting less than 15, 20, 30 minutes, where you have incredible shortness of breath, diaphoresis, palpitations, tachycardia, hyperventilation, quivering voice, upset stomach, nausea. You also feel like something horrible is going to happen. You feel like the end of the world is coming. And what happens? Many times you have chest pain. Many times you have jaw pain. Many times you have numbness in your extremities, to the point that where do you end up? In the emergency room. So it's very common in panic disorder questions for them to give you a patient who has panic, but they throw in there this extensive family history of cardiac disease. And the reason they do that is to confuse you into making you think that the patient has cardiac problems as opposed to panic disorders. Now, panic attacks, of course, are typically going to occur at numerous occasions, and what's important is that they are always out of the blue, and that is what makes them so difficult to control. If you knew when the attacks were going to occur, that wouldn't be so bad. You could prepare for them. But what's essential of these disorders, of the attack, is that it could be happening when you are going home in the car. It could be when you're on a plane. It could be when you're lying on the beach. It could be when you're in a restaurant. It could be when you're in a crowded theater. So because you never know when the attacks are going to occur, what do you think happens to a lot of these patients? They end up staying home and they develop what's called agoraphobia. So panic disorder is diagnosed with or without agoraphobia, depending on the severity of the symptoms. Many patients become so paralyzed by the fear that they're going to have an attack outside of their home, that they're homebound. They prefer to stay home where they're safe, they feel secure, and if they have a panic attack, they don't have to worry about it. Now, patients who have panic attacks or panic disorders should certainly stay away from certain substances. These are called panicogens. These are things that will help induce a panic attack. Sodium lactate, for example, is one of them. Yohimbine, carbon dioxide, epinephrine, alcohol, caffeine. What happens in anxiety disorders is that many times patients drink in order to calm themselves down, and they think, oh, no problem, I'll have a couple of beers, I'll have a couple of drinks, and my anxiety will get better. Well, guess what? When you drink and you have panic, that increases the risk of panic attacks. So you have to tell the patients to stop drinking in order to make their panic disorder better. It occurs in about 2% of the population, always more women than men. The ratio is 2 to 1. It tends to occur during the 3rd decade, so we're looking at patients who are in their 20s. And of course, as is true in every disorder, the symptoms tend to wax and wane. Now, typically, like I described earlier, the attack is going to last a few minutes, and it's usually accompanied by impending fear or doom. And you're going to have the other disorders. Many of these people are self-medicated, so they abuse drugs. Many of these people also have depression. Many of these people also have overlying anxiety of another kind. The treatment of choice will either be an SSRI or a benzodiazepine. If the patient has a panic attack, we're looking at an attack that is going on. SSRIs take weeks to work. So if the question were to state, someone in the emergency room or someone in your office who is currently having the shortness of breath, all of the physiological components, the SSRI is not the answer, but it's the benzo. Why? Because benzos work within minutes and you stop the attack. If it's the treatment of the panic disorder, then of course the treatment will be the SSRI. Ideally, you use both, SSRIs and benzodiazepine. Once you control the panic attacks, then you start tapering the benzo. Then you maintain the patient on the SSRI and you keep them on the medication for more than 6 months. What if the patient starts to lower the SSRI and their symptoms appear? Then put them back on their regular dose and keep them on the medication for a longer period of time. But because panic is an anxiety disorder, all anxiety disorders would benefit from behavioral techniques, relaxation techniques, breathing exercises, guided imagery, anything that helps them through the panic attack. Many patients will know when they're coming. So when they feel that, they can start imagining themselves on a beach, imagining themselves in some forest, trying to relax, trying to breathe slowly in and out, and many times they can stop the attack from occurring. But if given the choice between SSRIs and benzos, for the attack, it's the benzo. For the disorder, it's the SSRI. And if given the choice between pharmacotherapy and behavioral therapy, pharmacotherapy is always the best treatment for panic disorder.